most people forget about, is kind of a bit of a misnomer. So the pain can be a different distributions, but it essentially is pain that usually begins in the back, travels down the leg. Something actually cross the buttock into the thigh sometimes. But sometimes if that pain is coming from the nerve in the back called sciatic. We call that more specifically. Radiculopathy only goes to one side of your body. It could be both sides. Depends on the cause of it. So sometimes if you have pretty two discs on both sides, or you have just stenosis of the nerves or pinching off of the nerves as they come down. Sciatica cookie bilateral, oftentimes. The exit, where the nerve root leaves, the body can be smaller than it usually, is it? Sometimes you get it on both sides. That way too, unilateral or bilateral side. Sciatica. So what are the common symptoms? Any mentions being should have done a leg. Are there any sort of trifecta of nerve pain? Is generally symptoms is generally pain, numbness and or weakness, and it could be a combination of those things, or it can just be one of those things. So sometimes people present with Jessup, isolated weak muscle group, and it can be from sciatica or pinched nerve in the back. Sometimes they present with just pain more. Sometimes they were chronic. Does it go away? That's a great question. That sort of depends on the cost of the pain. So let's talk disc herniations for a second. So if you have a disc herniation in your back and it's pinching a nerve as it travels down your leg, or it's pinching a nerve in your back and you can paint it travels down your leg, almost 90% of the time that will just go away. So activity, modifications, sometimes medications, we're going to get into some future. If it's something that probably won't go away, then that we start talking about different. Let's talk about the sciatica nerve. Where is it located? The sciatic nerve itself is not really even though it's called sciatica, as together, as they traveled on her leg in the travel, into your leg. So lower lumbar and sacral nerves were forms. And I'm nervous. The back of your leg. A lot of times people have made from cultural free and they still call that. Sciatica is just a picture of higher up, the lumbar spine. The spine, and where you feel that general is in the library, different types of as it's not, really, it's just pain that she's done a leg, or numbness or weakness. There's different causes of, okay. So I always, when I'm educating residents or fellows, we talk about, what's the diagnosis? What we wanted in surgery. If they say score, they said, lumbar-spinal stenosis. That's not correct. The answer is because what I'm describing is the symptoms that the patient has expired. Some of their causes are something else. So, disc herniation is relatively common cause, just a generation arthritic development. So, nobody's really free of spine arthritis, right? So it kind of affects us all. Most people have an episode of back being lives. Most often, that's not due to arthritis or problem in the spine. But when it is, we're up, right? We stand on two legs, right? And because of that, our district degenerate over time as that happens, right? The sides of the canal will just pitch a specific nerve and causes of sciatica or radiculopathy. And if it's as it sounds like all of them hard because of each other. Sometimes this creations, our program, nice young healthy backs and have no problem, nor friends, which was just bad luck. Genetic issue. The disc is like a jelly donut bite, so the inside of it can hurt it out if there's a weakness on the outside, and so that can happen in a help desk. Can we talk about some of the risk factors for So again, H is a risk factor, previous injury, disc degeneration, weight is a big one, core strength, so the stronger your core is, the more support you have for your lumbar spine. And that's why people tend to get issues in the lumbar spine, as opposed to throw a 6, because we have supported rib cage, and a thoracic spine. In the lumbar spine is just our muscles that support us. And that's why we always talk about core strengthening with some issues. So you mentioned weight and pregnant. Women usually complain from sciatica. Is that the reissue? No, it's not. Just wait. So and this is a little bit outside my area of expertise in terms of obstetric care. But when you're pregnant, your ligaments loosen up a little bit due to the circulating hormones in your body. And that could be a logical conclusion for why sometimes these women deal with this key issues as opposed to when they're not pregnant. I would say it's just a wave phenomenon by any means. Great. So this is kind of over time then with, just like you said with each, right? And it just comes on and shoots down the leg and the whole thing over time gets better. If it doesn't get better than this, where do I come in? However, oftentimes that is just anything. If you have a slow arthritic process, sometimes he has some good days. You have some bad days and then you notice that it just starts to get worse as time goes on. Just kind of persistent and so independent. So variable. That's what's very interesting about spine surgery in general. There's so many different causes for why somebody may hurt no lady, and because of that different communities one. What about the head? Absolutely. In fact, I just got done seeing a patient that has hip arthritis that was referred to me for a nerve tissue, and when you examine her, heavens, very painful. It was painful in the morning, it's painful when they put weight on it. And so these are all things that when you see your physician, they should be able to work out. So hip arthritis and hemarthritic pain, or hip issues. Generally going pain. It hurts when you put weight on it. If someone's in the office of arranging, your hips are moving your leg around and they kind of reduces their pain you have, you know? That's a hip issue. Okay. If you have pain, that's where starts to come back. Kind of radiates towards the hip, or down the legs, associated with numbness, tingling sometimes, weakness. Most likely that's a nerve issue. That's a sciatic. You're supposed to hit the chute. That's something we think about with every patient that we see. Last thing we want to do is subject somebody to a course of treatment. Which running? Not really, they're back. We want to make sure it's the event. Make sure it's something else. So can you give us maybe signs? That has special sure. So, one thing I'd say you'd know, right? So it's not that subtle pain, right? So typically at least, what? I see, and that's a little bit biased because I see people that are generally failed conservative treatment, but it's my leg hurts. It's numbness, tingling. I can't move my foot as good as I did before. I didn't have this pain a month ago and I have it. Now these are all reasons you should seek medical care. Great. Let's talk about diagnosis. How do you diagnose with you? There's a kind of a standard thing, so take a good history. Okay. Are you telling me the things that make sense for sciatica? Okay, if it's only hurts in my groin, and it hurts when I put weight on my leg, I'm going to sing to him. If you say that I have numbness tingling down my leg, all think he's probably from sciatica or pinched nerve in your back. We matched that with the imaging. Okay. So, typically it's diagnosed or the diagnosis is confirmed with an M-on. We always like to start with plain X-rays. Reason being is please tell us a lot of information in them. Or I cannot most pointedly. They tell us what your spine looks like you put weight on it. Okay. So there are certain conditions where the bones may move and the spine abnormally. And the only way to really diagnose that if, when you lay down, they would uses. When you stand up, only way for me to see what your spine looks like, one stands on his with a plain X-ray. So I tend to want to have plain X-rays first, but an MRI will show the nerves very well. And so an MRI is great to confirm crush-on disc herniation, the condition that's pressing on the nerve of those all show up to confirm the diagnosis. And then certainly the physical examination is of paramount importance are there. Certain things that really key us into this, as probably a pinched nerve, right? So there are some special test called the straight leg test where we raise your leg, and if it reproduces the pain down the leg, that's very good indicator of the fact that is coming from your low back. If I raise your other leg, okay, let's say you've been down the right leg and I raise your left leg and it shoots the paint on the right leg. It's even better indicator that the pain is coming from a picture. Aside from that, we can test all the specific lumbar curve roots with physical examination. Muscle strength lies in the leg. Everybody that comes to the office has to walk. So, if you come to my office, I'll always make you walk, okay? I want to see what you look like when you're loading your spine. When you're trying to pivot from one foot to the other, you change the way your weight looks. That's all very important. Most of the often I have people walk on their toes, walk on their heels. So I can see that they have the strength of their calves and in the front of their legs to be able to do that. Before we go into surgery, and hopefully we don't have to, but what are the non-surgical treatments? So non-surgical treatments usually resolve the problem. The first thing is time, right? We talked about that earlier. So if you have a disc herniation, time would usually just take it away, okay? The other thing is physical therapy. Core strengthening is important, okay? So you stretch your low back, you strengthen your core. This will all support the spine and take pressure off the spine by strengthening the support system around 10-12 am as well. There's certain medications we can get that are good medications for nerve pain, not addicting type of medication. So the first thing is usually wanted this craze, or they have sciatica. Sometimes it's associated with muscle spasms in the back too. It kind of sets everything off at once. So we'll give a low-dose muscle relaxant medication that will help relax the lining of the nerves for the membrane of the nerves. We'll do those two in combination, and probably the mainstay of medication treatment is an anti-inflammatory, usually in an acute phase. That would be something like a steroid, where we give somebody a tapering dose steroid where they start high and they get lower on it, and sometimes it's an anti-inflammatory like ibuprofen or Mortrin. So typically it's those three things: medications, therapy, and just giving a talk. Let's say none of that works. Sometimes going out in pain, still mad. Often time for my son, somebody for an injection. In the injection may be diagnostic, and it may tell me that the pain is coming from this term. So let's say, I think the pain's coming from L5 and I give you an injection L5 and you get better, but it gets worse again. At least I know, diagnostically speaking. That's where the problem is. If we can address that, surgeon, we will probably have pretty good result. The other thing, injections can be, is therapeutic. So, if I give you an injection and it takes away your pain for months, well then we've done our job. The surgery just have the injection. Okay? And so we use injections, and that's probably not hurting people without a specific injury to their back. I don't think that fight gravity.